Look at you.
On this episode of Bondi Vet,
Hi, baby.
Audrey and Alison try to save the toe of a tiny kitten rescued from the gutter.
The danger is that that infection will spread. Once it's in the bloodstream, it pretty much can be fatal.
She has a lump on her neck.
That is a little bit of a concern.
Could tragedy strike twice for an owner who's just lost 2 dogs in a freak accident?
1 minute we're sitting on the beach enjoying the sunshine, the next minute they're just gone.
I don't want to be the one bringing them any more heartache. They simply don't deserve it.
His eyes are really swollen. His reaction is actually happening right now.
And a terrifying emergency for Tim's baby wombat, Kenny.
If this continues at this rate, it could be very dangerous. That's scary.
You make my world a better place.
Come on, there's your girl.
I can depend on you.
At the Kitten Sanctuary in Sydney, rescuer Amy is tending to her charges while she waits for mobile vets Alison and Audrey to arrive. The young animal lover began taking in stray orphans 3 years ago.
We are one of the very few rescues in Australia that do take in kittens this young and hand raise them, specialising in taking in orphan neonatal kittens, which are at the highest rate of euthanasia across pounds and shelters in Australia, so we wanted to change that.
But while these youngsters are thriving, recent arrival Misty is not so playful.
Somebody found her on the side of the road during the bad storms that Sydney had a few weeks ago, and we took her in.
The 5-week-old kitten developed a badly infected toe when fellow orphan Stormy tried to suckle it like a teat.
Looks very festy, doesn't it? I think we better have a look at that. I just got to keep it straight, so 1 second. All right, well, let's take her out, have a look at that foot.
Today, Audrey and Alison will be assessing whether the toe can be saved.
I might check the rest of her over and then we'll end up at that toe. Just make sure you're growing okay. Now let's have a look at that toe, right? So she's been on broad spectrum antibiotics for about a week, and if anything, that's actually looking more swollen and more infected. So I'm worried that that infection's getting worse or possibly spreading.
I saw her licking and chewing at that toe before, so it must be irritating her, being quite painful.
I just want to check it's just that 5th digit, so 1, 2, 3, 4, and that whole swollen area is just her last digit. I mean, besides that front toe, she's actually doing quite good. She's very small for her age.
Yeah.
We think she's about 5 weeks, so she's a bit small.
Just noticed she's got a little swelling on this back left leg here.
Yes, she does. That was
It
quite
feels like there's
nasty.
some fluid under that skin. If you can take a look at that, please. Oh, it's so swollen. She has been licking and chewing at all her joints after licking, obviously, this infected toe, so she could possibly have passed the infection, but it's another joint, so that's a bit of a worry.
So the danger of an infection in a young kitten, especially one that you can't get on top of, is that that infection will spread. It will either spread along the foot or it will go into the bloodstream, and once it's in the bloodstream, it pretty much can be fatal. So next steps, little one, we're going to have to find out how bad this infection is. So we'll take an x-ray of the foot, and then from there we'll work out what the next plan is. Big day for you in hospital. You're going to be brave.
Audrey and Alison are now taking Misty to a nearby partner practice for further investigation. First, the twins must sedate Misty for her x-ray.
So because Misty is so teeny tiny, we're not going to use a normal x-ray machine for her. We're actually going to use a dental machine, because that really takes fine structures like teeth into the image, and so something like Misty's little fingers and toes, that will show up really nicely for us. Okay, so it's not looking good. We can see sort of the bottom half of the toe is there, and then all the bones kind of disintegrate. It's missing kind of the first bit and also the nail. So it looks like the infection's kind of dissolved away the bone, which isn't great. So I'm very, very worried if we leave it there, she could potentially lose her whole foot or her whole leg. So we need to jump in quickly and remove the infected bone. Really hurry?
Let's just slow down a little bit. We're trying to put Misty on the anaesthetic right now, and it is proving to be a big challenge.
1, 2, 3, 4, 5. 1, 2, 3.
She's not really stable, her breathing is all over the place. We're having to give her artificial respiration because her oxygen is not quite 100%.
How is he light and then deep? 1, 2, 3. It's always really difficult in little cats because everything's super tiny. So trying to get a tube in is difficult. Trying to get her oxygen levels is difficult. Oh, they're so tiny. So we have our work cut out for us. Good girl. Good girl. I see 100. That is very, very good. So Misty's now stable under anaesthetic and I'm ready to go ahead with the surgery. It's a tiny little leg and we've got to prep the whole area. So we've got it all taped up, hanging from a tiny light with some tiny, tiny tape. And we've got our tiny scalpel blade ready. But what I might do is just leave wide.
It's just coming away.
The tiniest toes you've ever seen. We're done.
Before closing up the wound, Alison gives the toe area a thorough clean.
We're going to do about 5 of those. All right, we can turn her anaesthetic depth down. So all taken off, sutures are all in.
We're putting on a really lovely little bandage. Everything is in miniature because her leg is so small.
Hello, good morning, tube out.
And now she's off to recovery in her beautiful little incubator.
I'm going to put you in here where it's nice and warm.
And hopefully she'll recover nice and awake for when Mum gets here this afternoon.
Hi, Amy. Hey. So Misty's recovering really well. We've just got her back in her incubator where it's nice and warm. Awesome. Was a very big surgery because we removed that necrotic bone or that bone that was infected. That came away really nicely for us and we were able to close up.
Now you can have a little cuddle.
Yes, you can show Mama your boxer gloves. Hey, baby.
Okay.
Yeah, she's recovering so well. So she's going to be a little bit groggy for the rest of today, but as soon as she's up and swallowing properly, I think give her a bottle.
Okay.
And I want you to continue on with those antibiotics. Oh, you're looking for your bottle. We better get you home so you can have some milk, all right? I'll help you bring her to the car.
Thank you.
Pop you back in the warm.
A few days later, Audrey's returning to the kitten sanctuary to check how Misty's foot is healing.
Hi, Amy.
Come on through.
Thank you. Hi, Misty. All right, let's pop her out so I can have a look at that bandage.
Hi, Miss.
How's she been going over the last 3 days?
Yeah, she's been good. Her appetite's picked up. She's gained a bit of weight. And she's a lot happier. It doesn't seem like she's in as much pain as she was before.
Great. So if you want to give Misty a cuddle, I'm just going to moisten the top of that bandage and take it off. I'm anxious to see what's under there, whether the swelling's gone down and whether the infection has gone away.
It's okay. It's okay.
It's a critical moment because obviously if there's still infection, we're in trouble. You're going to fight to survive, aren't you? Let's have a look, see?
Good.
That looks really good.
Yay!
So all the stitches are intact. That's healing really nicely. There's no swelling or discharge. The other toes look great. What's even better news is that all that swelling that was around the area and above the area we amputated, that's all returned to normal. So hopefully just by removing that infected bone, we've got rid of the infection.
Okay, amazing.
Once that grows back, I don't think you're even going to notice it at all.
Yeah.
So I'm super happy with how it's healing. I think we got it just in the nick of time. I'm really happy, so I'll see you in about 7 days or so.
Perfect.
Promise, give me a ring.
Awesome, thank you so much.
All right, see you, Amy. Bye.
Thank you.
So as a vet, doing a case like this is incredibly rewarding. We've given Misty a second chance in life. She was found in the gutter with no mum and no love, and now she's on the mend, and hopefully she can find a new loving family.
You know I love you too. You know.
There's really not enough room in here for this. All right.
Claire's getting ready to bring in her German short-haired pointer after a lump was discovered on Lola's neck.
I didn't find it myself. It wasn't visible to look at. A friend of mine was petting the dogs when she was looking after them. And the next time I saw her, she said, "Oh, you know, Lola's got a lump on her neck." I was like, what? No, I did not know that Lola had a lump on her neck. Of course, whenever anybody says it's a lump, the first thing you think is, oh my God, it could be cancer, it could be serious. Oh!
Right now, Lola's showing no symptoms, and her little mate Betty is showing no sympathy.
I know.
But Claire is not coping nearly as well. A year ago, her life changed forever when she made a sea change to Cornwall with her 3 dogs.
It was me, Lola, a miniature Schnauzer called Scruffy, and a miniature Dachshund called Sprout.
The little family loved their walks on the beach, until one day a freak wave crashed in and dragged them all out to sea.
The undertow was just unbelievable, and the beach was shingle. It was like being on ball bearings, and I was just sucked out. I thought, this is it. This is where I die. I don't get to say goodbye to anybody. The next wave, I hit the beach and I jammed my arms and my feet into the shingle as hard as I could. And I scrambled up onto the bottom of the seawall. And I looked around and Lola was there. So she either not got sucked in or got herself out. She's muscly and she's strong, so she had the strength. And I turned around and I could see Sprout's body floating upside down. And I saw the end of Scruffy's tail. And then the wave came in. And I just started screaming. And that was just so fast. And 1 minute we're sitting on the beach enjoying the sunshine, the next minute they're just gone. She wasn't this grey before the accident. She got all grey.
Claire couldn't face living near the beach anymore and finally sold up and moved back to Richmond. Both she and Lola were scarred.
Lola was terrified of life. She was just completely frozen. Getting her to eat after the accident was an absolute nightmare. She was just, no, not interested. She's so stubborn.
Finally, Claire decided there was only one answer. This little terrier puppy turned out to be the therapy they both needed.
When I was watching them this morning, climbing all over each other, I was thinking, oh, we've come such a long way. And she's so much happier. She's kind of almost regained some of her puppyhood. So, yeah, it's a completely different world. Better go and get it checked out, love.
But now it's time for Lola's appointment with Scott.
You try and think, oh, it'll be fine. Surely I won't be so unlucky. But, oh, God, it would be heartbreaking. The thought of losing her on top of everything else. All right, we'll go and see Scott.
Hello, lovely ladies. How are you?
Nice to see you.
And you. Hello, Lola. Hello, beautiful.
Scott's now ready for his consult with Claire and Lola.
Come on in. So, what is our beautiful girl in for today?
She has a lump on her neck here on your side.
Okay.
A friend of mine noticed it.
Right. Oh, yeah. That is a little bit of a concern. The worst case scenario for this is the big C, it's cancer. That would be an absolute nightmare. If I felt it in my dog, yes, we can take samples and we can do all sorts of things, but I think after everything that you guys have been through, I don't really want to risk it.
No.
And I actually kind of feel that if it was my dog, I would just want it out and dealt with.
Whatever she needs, then that's what we'll do. Hey, baby, we can't have you sick. No, we can't have you sick.
It's just such a tragedy that just as you see them getting to the top of the mountain, Lola and Claire seeming happier and settled back here in Richmond, that they're hit with this. And I don't want to be the one bringing them any more heartache. They simply don't deserve it. So Claire, I always think in these instances that take the Band-Aid off quickly. All right, so I think if you head off,
Okay.
I will look after your girl, we'll get it done as soon as possible,
Yes.
and then we'll move forward together.
Okay.
Okay, all right.
Thank you.
And you know I'm gonna take care of her.
Yes, I know you will. Go on. Scott's almost as good as me.
Almost.
Bye.
See you later. Say bye, Mummy.
It's hard saying goodbye to her because I know she's going to get upset. She's likely going to be anxious and confused and scared. It's the bit that really upsets me.
Well, let's give you some nice happy drugs, get you chilled out and get that horrible lump taken out. Yeah. Good girl.
Time for sleeps.
Good girl.
Scott and head vet nurse Emma are about to start the surgery to remove Lola's suspicious-looking lump.
Mummy would be proud of you, wouldn't she? Yeah. German short-haired pointers are known to suffer with certain types of soft tissue cancers. And in my nearly 20-year experience, I've seen quite a number. Em, have a look at this. This is the lump I don't like the look or feel of.
Has it been growing for quite a while?
She's only just picked it up. And the problem is, if she's only just picked it up, that means it's growing quickly.
Yeah.
And growing quickly, we know, is a good indication of malignancy of cancer. That's why I feel so strongly that we need to get in, get rid of whatever this is, and hopefully give Claire the result she's looking for, which is a clear one. So I'm just gonna cut through the skin and have a good look at it and see if I can remove the whole thing. I'm liking the look of this more and more.
Oh, there it is.
Thank God, this looks like it might be something benign.
So the minute that Scott made the first incision, I think both of our eyes lit up when we saw this big lump of fat.
When a mass looks fatty, it could be something called a lipoma, which is a benign lump, not cancerous, which would be totally awesome. And that's a veterinary technical term.
Totally awesome. Yes.
For a relieved vet.
Yes.
But Scott's relief is short-lived.
So right next to the jugular.
Nice and easy with the scissors, Doc.
While the mass does appear to be benign, it's dangerously wrapped around the jugular vein, which is the very large blood vessel carrying blood from the head back to the heart.
There's the jugular vein right there.
If this vein is cut, the patient can die within minutes.
I was pushed to the limit because we're literally millimeters away from cutting a major blood vessel and causing a huge amount of blood loss. It's holding on for dear life, this thing. Get out.
Like all fat. It just doesn't want to go anywhere. It's the hardest thing to get rid of. Okay.
Very close to the jugular. It's the whole lump. Here we go.
At last, Scott is satisfied he's removed the entire mass, and the jugular vein is still intact.
If I'd cut that bad boy, I would have definitely made a mess of your surgery room.
Blood splatter's not so easy to get off some white walls. Very cranky nurse on your hands.
You'd be mad, Claire would be mad. Yeah, I'm really glad that I didn't. The relief that I felt when I could see that this wasn't a mass that was going to be life-threatening was just overwhelming. Fantastic. Never have I thought looking at fat would be
So satisfying.
So satisfying.
This is definitely a day where fat is good.
There was an absolute wave of positivity. I couldn't get the smile off my face. I was absolutely elated. Oh, you're good, aren't you? What a brave girl. Yeah, what a brave girl.
Oh,
thank you, sweetie.
Kisses for Dr. Scott. I think Lola was definitely saying thank you. She looked into his eyes and gave him a little kiss on the nose. I actually had a tear in my eye. It was beautiful.
That's nice. Yeah.
I cannot wait for Lola to wake up and just to send her home with Mum, get a kiss and a chew probably from Betty, and to give Claire the good news. I'm sure she's going to be ecstatic. All right, let's let you have a snooze and we'll call Mummy. Yeah.
Downstairs. I'll see you in a minute. Been on your own all day. Been on your own all day.
Later that afternoon, Claire's back at the Richmond practice with Betty, anxiously waiting for news about Lola's operation.
Where's Mummy?
Yeah, hello. Hello. Oh, she's more interested in Betty. Lola.
Lola was very happy to see Betty and went straight to her and seemed to be more excited to see her than she was excited to see me.
Oh, you two are gorgeous, aren't you?
I'm glad that they get on, and you know that's what I wanted, for them to be good friends and support each other.
So, can you see this?
Yes.
This is a smile.
What does that mean?
It means good things.
Yes.
It means very good things. I'm absolutely relieved to tell you that when I cut into the mass, it's a fatty growth.
Oh! Oh! Oh my God!
She was ecstatic, she was overjoyed, and so was I. Certainly all the information we'll get from the lab will just confirm exactly how I'm feeling, but right now, I'm feeling good.
God.
I know.
Oh. Oh, that's it, it's over. We are lucky, Lola. Hasn't seemed like it this year, but a bit of luck at the end. Eh? Yes. Good girl. We're all good. We can forget about this horrible incident and get on with just having fun.
Oh yeah, everything's good now. No more nasty operations. No more nasty operations.
Later that month, the famous St. Margaret's Fair is in full swing, and Scott and Claire meet up again.
Hello.
Hi.
Great to see you.
I know.
Scott's been invited to judge the dog competitions. With Lola having survived a recent cancer scare, Claire is feeling lucky.
Do I expect to see an entrance?
Yes, so we're going for cutest puppy.
Cutest puppy,
I think she might be the cutest puppy.
Of course you are.
I think we might be in with a fairly good chance.
I know one of the judges very well.
Okay.
Very well.
All right.
So, yeah. So I think you might go quite well.
Okay.
I think I might be a little biased. I have a feeling that I might have met a dog that I think's gonna win, and maybe I'm a clairvoyant, but Betty, she's got a good chance, I think.
And Lola can be pretty as bit. Best veteran?
Surely we can find a better name than Prettiest Bit. Let's go for Prettiest Old Lady, shall we? Yeah, it sounds a bit harsh otherwise. So good to see you.
And you.
Good luck at the puppy show. Good luck.
Back at the St. Margaret's Fair, Scott is now busy with his official duties.
For the third year in a row, I've been asked to be the judge for the dog show, which sounds like it should be awesome and lots of fun, but actually it's really quite difficult to be impartial. I know so many of the owners and so many of the dogs. And of course, like me, every owner thinks their dog's the best looking dog in the world, but there can only be one winner. Bobby! Bobby! Bobby, look, what's this? What's this? You ready? You can't do cheating. Okay. Bobby!
Bobby's giving his all in the best trick competition, without much luck.
No. This is what's good with it. Oh, never mind, Bobby. All righty. Well done. Good effort.
But it's the cutest puppy class that has Scott's full attention. And it's time for Claire and Betty to strut their stuff.
This is a Sealyham Terrier called Betty.
Betty seems keen to check out the competition. It's going to be a difficult decision for the judging panel.
Betty's in the final three. It's very tense. The judges are just deliberating. I feel very strongly about Betty, so let's see who comes out on top.
And that winner is Betty.
I suspect that she didn't win it entirely on her own merits, but I'm sure she could have done. There we go. It was just so lovely to feel that I'm back here and things are getting back to normal. It makes me feel good that we've kind of like come through this. Thank you! Victory!
Yay, Betty!
Yeah.
Cutest puppies. Eat your heart out. You're the cutest.
So if we could have Scooby, Jura and Georgie.
Oh, and best liquor. There you go.
And best liquor. Oh,
Congrats, well done.
Thank you. Come on then. Oh, I think somebody's ready to go home.
Tim from the Australian Reptile Park has given me a call because he's concerned about a baby wombat called Kenny. Now, all he's saying is that Kenny has a mysterious problem. So I'm on my way there now to see if I can help out.
Kenny was found on the side of the road after his mum was killed by a car. Over the past month, Tim has been his foster dad, hand-rearing him.
He's recovered really well from his original problems and he's been feeding well, he's hydrated and everything's been great. But something happened yesterday that really scared me, and that's why I've called the vet. G'day, mate.
How are you, mate?
Good, how are you? There's our little mate.
That's quite incredible. Look at you.
He really scared me yesterday.
Takes a bit to scare you. What do you do?
Well, the day started out normal. So we got up, had a bottle, bit of a cuddle like this. He slept for a few hours, so got him back up. I took him for a walk, his first walk, because until now he's been settling and in an artificial environment. Went for a walk, brought him back, and he just blew up. His eyes swelled up, his hands swelled up, around his neck went all red. I really have no idea what it could be. I don't know whether he's been bitten by an insect or it would seem that something triggered it, but I got no idea.
Have you got any photos of how he looked?
I've got, yep, one. Look at his eyes.
Yeah, wow.
And that was mirrored under his chin, on his belly, and his hands.
If Kenny was a dog or a cat, you'd be thinking maybe he's been bitten by a bee. Or maybe he's eaten something that wasn't quite right, or he's come in contact with a chemical.
I mean, it was his whole face and his paws and everything, and I was freaking out that he was going to stop breathing.
I think, Timmy, the only thing to do is to take him back to the scene of the crime.
Yep.
Back to where it happened.
I thought you'd say that.
And let's have a look at what's around there and make sure there's nothing that we're missing.
Yep.
As a vet in this day and age, you can run all sorts of tests, ultrasounds, MRI, CT scans, blood tests, you name it. But this test may be the most important for Kenny. It's a walk.
Come on, little man.
This is the same track as yesterday.
Yeah, same way. Come on, Kenny. Yep, he's hot on your heels.
So the funny thing is, we haven't gone over any ants' nests.
No.
I haven't seen one bee.
No.
It's just been grass.
Yep. And this is the longest bit. I brought him in here, just in the fern and grass, and he loved it. He had a good play.
You can see straight away, he really enjoys this, doesn't he?
But that was the extent of the walk.
I'm starting to think that today we're really not going to see anything of interest.
Come on, Kenny.
When all of a sudden, Kenny just doesn't seem to be keeping up like he was before. He seems a bit clumsy, and then I look at his eyes, and they're different.
Yeah, look at that. Oh, it makes my eyes water.
He's hot all over, his ears are puffy, his eyes are really swollen.
Eyes.
Hang on, man. His feet, they're getting really puffy too. I mean, look at those.
What's really concerning me is that he looks sore, irritated, and I don't know the extent of this reaction. If we can see this on the outside, what's happening on the inside? That's scary.
The worry I've got is that it looks like his body is now experiencing quite a significant reaction. If this continues at this rate, it could be very dangerous. His ears are really thick now, his eyes are swollen, his feet are very puffy, so his reaction is actually happening right now.
Okay.
Just hold on to him there. Allergic reactions become life-threatening when it starts to affect your airways. So the important thing right now is to put the stethoscope on and listen to Kenny's lungs. His heart rate and also his respiratory rate are actually quite high. That's from chasing after us on the walk, but also his whole body at the moment is going through a big reaction.
Yeah, I can feel he's hot.
So we need to work out exactly what he's allergic to that's causing that. But In the meantime, let's actually give him an injection straight away, because I just don't want this to get worse.
The reaction's happening, but different to yesterday, Chris is here, and he's got an injection, it's an antihistamine, and that'll slow this thing down.
So if you just, yeah, that's perfect. So we'll just go between the shoulder blades here.
Yep.
You know from humans and bee stings, the fact that the first one is often bad, but the ones after that can be even more severe. If Kenny is like that and these reactions are getting worse with time, we need to treat him right now, otherwise this could become fatal.
Hold still, buddy. Hold still.
You look at where this reaction's taken place, it's around his feet, around his face, around his ears. You look at the way wombats walk, obviously with their feet, and the head goes through everything first.
Yes.
So this is a contact allergy. It's not something he's breathing in like someone that experiences hay fever or asthma.
Yes.
It's something he's actually come into contact with, because this is what hits things first.
Yep, makes sense.
Okay, so let's...
That's scary. Just gonna wash it off him.
Yeah.
Jeez, his eyes are closed now.
The antihistamine injection and the wipe down have certainly bought Kenny some time, but they've also bought me some time. They've given me a chance to go back through that walk step by step to work out exactly what Kenny came into contact with. And there's really only one thing.
What, hang on, man.
Over the years, I've had to unleash a fair few surprises on Tim, but this one today might be the biggest one yet. He's really irritated, and you got to feel for him. That must be an incredibly uncomfortable thing to go through. And I guess, you know, our goal has to be to make sure this is the last time he has to go through it like this.
Yes, please.
What if Kenny was a wombat that was allergic to grass?
How can a wombat be allergic to grass?
Exactly.
It's like a dolphin that's allergic to water.
Exactly.
Does it really exist?
Yeah. Ironically, the one thing that Kenny can't live without is the one thing right now he needs to live without. When his mum was hit by a car, all of a sudden his life changed.
Yes.
And he was no longer in the pouch. He's had to be hand raised.
Yes.
So he's never really been around grass.
Yep.
Except for the walk yesterday and the walk today.
I've reared a number of wombats, and some of them from sizes much smaller than Kenny. And each time that I've introduced them to grass, they've been fine. I'm left speechless with Kenny. How can he be allergic to grass?
Kenny has lived that clean life because
Sorry, mate.
he's had to be hand raised by you. You've done everything right. But in the process, he just hasn't come into contact with this stuff.
Does that mean he has to get used to it and he'll get better, or is this going to get worse?
There's no way Kenny can live his life without grass. So he needs to find a way to live with it. And that's where my plan comes in. There's a way we can do it. But I reckon the most important thing right now, let's get him off the grass.
Yeah.
Back to somewhere nice and cool. And then recover. So, away from the grass, and with that injection, I reckon he's going to be looking a lot better.
Oh, he looks much better.
What we're going to do is take a preemptive strike on his allergy. Allergies essentially work the same way, whether you're a wombat, a dog, a cat, or a human. So the solution centers around that theory. And rather than him having less walks, we're going to have more walks.
Righto.
But the walks are going to be shorter.
Yep.
And he's only going to go to the grass for a few minutes at a time.
Okay.
And what you're going to do before that is give him a quarter of one of these tablets.
Yep.
Brush that up into a powder. The way we're going to deal with it is with antihistamine tablets. It stops his body from overreacting and producing all those histamines which cause that reaction. And put that into his milk.
Just like that.
You're about to lose it, aren't you?
Yeah.
Yeah?
Yeah, I took a hay fever tablet this morning. I'm not allergic to grass, but yeah, I did.
So, if you guys have the same ritual, then it's perfect.
So we go to sleep together, we wake up together, we medicate together.
Well, it's the proper family unit, isn't it?
Kenny and Tim will both have their next lot of antihistamines tomorrow. Right now, it's Chris's turn to play mum.
Would you like to do the honours?
Love to. Kenny's a pretty simple little character. He loves his bottle and he loves his walks. And now, hopefully, with his tablet, he might even learn to love grass as well.
You think he's going to take the medicine all right?
What do you reckon?
Yeah, I didn't think there'd be any problems. I like what you suggested.
I think we've got a plan now that means he can still be around grass, but can, hopefully, overcome the allergy as well.
You ready? Into the bottle.
Next morning at the Australian Reptile Park, Kenny is about to get his first dose of medication.
All right, mate. There's yours. Here's mine. Time for some milk and antihistamine. Chris's instruction was Kenny needs to have his antihistamine in the morning with his bottle and then wait an hour and we can go for a walk.
An hour later, it's time for the big test. Tim is anxious to see if Chris's prescribed antihistamine treatment will prevent Kenny's allergic reaction to grass.
Come on, buddy, let's go for a walk. Come on. The path we're taking today is identical to the path I took yesterday when Kenny had the reaction. Come on, Kenny. Kenny's just been for a 5-minute walk on the grass and we've got a tiny reaction in the corner of the eye, but nothing compared to when Chris is here. I'd have to say the antihistamines are working.
Who's that?
Hello, boys.
Is Kenny there?
A delighted Tim is now heading home to share the good news with a couple of Kenny's little buddies.
I think he missed you. Wombats have got to be my favourite because they're real individuals, real personality and character, and even though I love lots of other marsupials, some of them just lack that, and I don't know what it is about them, but they're really rewarding to care for. Take him for a run around the kitchen, please. He can just play with the boys. They love him, they exercise him, they keep him active, they give him his bottles. It's good for him and it's good for them.
Kenny will stay with Tim's family until he's weaned. Then his permanent home will be with the other wombats at the reptile park.
Can he go on grass?
He can go on grass.